So let us talk about endoscopy now. What is endoscopy? Endoscopy is a procedure in which a thin scope with a light and camera at its tip is used to look inside the upper digestive tract, like you can see here. So all the way, a tube is passed from above downwards from the mouth all the way up to the upper esophagus, mid esophagus, lower esophagus, and then into the stomach. Okay, so and all the way up to the first part of the duodenum. Okay, so these all the parts are carefully visualized in less than 2 to 3 minutes to help us visualize if there is any problem, that is erosions, erythema, ulcerations, any erosive gastritis, erosive esophagitis, ulcerations, or any other abnormal mass or anything that is visualized. Okay, this will help, and also we'll be able to diagnose whether the sphincter here is loose or not. Like I've already told you, if the sphincter is loose here, there are multiple possibilities that can possibly occur and can cause reflux diseases in the upper esophagus. So this endoscopy is more than enough to diagnose if you have a GERD or no. Okay, so endoscopy is also used to take simple biopsies from the stomach. Now, why should we take a biopsy sample? That is to see if there is any presence of infection, that is the presence of any infection at a microscopic level. So we take a small piece from the stomach and to see the presence of a bacteria called H. pylori. Helicobacter pylori is the most common organism that we encounter in a stomach that causes more problems like belching, bloating, abdominal discomfort, and vomiting sensation, chest pain, all those things. So everything, if this bacteria growth is halted, then probably we can get over with GERD symptoms as well. Okay, so now let us come to complications. So, what happens when you don't treat esophagus, when you don't treat GERD symptoms? Okay, so there is something called erosive esophagitis. So, this tissue which you are looking here on the left side, this is on the normal tissue. So, this tissue here, this is because of the acid reflux that has happened into the lower esophagus. This is almost like, so the tissue is burnt. Okay, so here there is lot of ulcerations that can be seen, that is all probably going in for a stricture. A stricture is basically something that is narrowing the entire lumen down to a point where the food further cannot pass by. Okay, eventually it can lead up to complications. Eventually patient cannot be able to have food, he cannot have solid foods. Solid foods will only obstruct here, and only it cannot pass by beyond this. Okay, so it can lead to erosive esophagitis initially. It can also lead to esophageal stricture. So, like already told you, leading to asthma is also there. It can cause cough in the night. So, rarely, in less than 10% of the patients with the erosive esophagitis, what happens? There is some entity called Barrett's esophagus, where the squamous epithelium is converted into a columnar epithelium, and eventually, if it is untreated, it can lead to adenocarcinoma of the esophagus or the stomach. So adenocarcinoma, like I have to explain you, is a cancer, esophageal cancer. So if it is untreated at a long, say about 5 years, 10 years down the line, if it is untreated, it can turn malignant. Malignant meaning it can turn cancerous. So it is very important to recognize these GERD symptoms before overlooking it in a minor issues. So it cannot be disrupted. For more than 2 weeks, more than a month, you cannot neglect dyspeptic symptoms. It is very important because even though there are less chances, there are chances that it can go and turn malignant. So I will explain you how a normal esophagus looks like, and a GERD, erosive esophagitis, and ulceration. So this is the normal esophagus. That is how you can see the mucosa is pale and pink. So here, when there is an abnormal constant reflux of the gastroesophageal reflux in the lower esophageal part of the lower esophageal sphincter, what happens? Eventually, it will start bleeding. Okay, when the bleeding is starting, the patient will have hematemesis, or he will start coughing blood. Okay, so these are the mucosal ulcerations. As you can see, after a thorough wash given the lower esophagus, the ulcerations look like this. Initially, it starts bleeding, later, it will heal. Once it heals, what happens? There is narrowing down of the esophagus lumen. Once there is narrowing, it can go into a stricture. that is the narrowing, and the complete patient will start having slow only. He eats very slowly, and there is only passage of liquids and not solids. He cannot tolerate. Usually, this is seen in above 50 to 60 years of age, but it can occur in young individuals also because of the day-to-day lifestyle that is everyday people are having these days. So, like I've told you, stricture or narrowing of the esophageal lumen. There are procedures that to dilate these esophagus also. Okay, so I am not trying to scare you here, but these are the procedures what we do on a day-to-day basis for people who have narrowed down esophageal lumen. Okay, we'll have to dilate the esophageal lumen, and then we'll have to passage of food is occurred from time to time of how the patient responds eventually. Okay, so last coming to gastric ulcers, there are some possible. This is inside the stomach, how we see in an endoscopy. These are proper ulcerations that are seen in the antrum. This is in the duodenum, or this is in the body of the stomach. So here we differently come to know these are the complications that are occurred by constant reflux. Reflux can go downwards, it can go above. If it goes above, it can cause ulcerations in esophagus. If it ascends below, it can cause duodenal ulcerations also. So it is very important to maintain a normal pH of the stomach. If you don't maintain a normal pH of the stomach, there are possible ulcerations that can occur in different parts of the stomach at different points of time. So, what are the medications that we usually use to avoid GERD symptoms? Okay, so most of you must have heard Rantac or Pan tablet. So, most of you must have been using this on once in a while, or some people usually abuse it on a daily basis. Okay, which you're not supposed to be doing. So, H2 receptor antagonist, that is ranitidine or Rantac, and or PPIs, that is pantoprazole, rabeprazole, or omeprazole. These are the common drugs that we encounter, are usually used or about span of 2 to 4 weeks, that we should find some response or some relief from the GRD symptoms. If there is no response, then the patient has to be planned for an upper GI endoscopy to identify and treat the underlying cause and treat accordingly. So, like I told you, there are multiple possibilities of why there might be a hiatus hernia which can be surgically corrected. There will be a lower esophageal sphincter that is lax, that can also be corrected by a fundoplication. There can also be gastric ulcers that can be treated with H. pylori medications. So different dyspepsia, different GRD symptoms have different approaches and different line of management. So not every GRD symptom can be treated with simple pantoprazole or ranitidine on an OPD basis. There has to be a reason behind why you are having gastritis symptoms. So what can we do on a daily basis to avoid these symptoms, and how can we make sure that we don't get such symptoms? Okay. So what happens when you avoid large meals? So when you when you take small meals, what happens? When the stomach is not too full, the food whatever we've eaten slowly passes down. When you eat a large meal, the large meals will only reflect upwards towards the esophagus and causing more irritation. So it is very important to have small frequent meals. Instead of having 3 meals a day, the patient is told to have about 5 to 6 meals per day. Say about 8:30 you have a small breakfast, then you probably 11:30 one more small breakfast, then about 2:30, 5:30, and then again 8:30. So when you split your meals, the food gastric content is slowly descending downwards, and it will avoid coming upwards. So secondly, you should avoid acidic foods. What are the acidic foods that we commonly encounter? Is tomatoes, citrus fruits like orange and mosambi, and strictly no alcohol, no caffeine. To some extent, onion, garlic, and peppermint also have been proven acidic, and it is better to be avoided in GRD symptoms. But here, as we need to take a close look at alcohol and caffeine, these are the things that our youngsters have been abusing these days. Caffeine for multiple reasons, like staying awake in the night, staying awake, especially for staying awake during long work hours, night shifts by IT people who keep stressing 7 to 8 hours, 10 hours, 12 hours. So I've heard people slogging for 15 hours a day with caffeine. So when you abuse yourself with caffeine or alcohol, definitely you are not going into the right direction. So you have to avoid such carbonated, high calorie foods and contents that can only trigger your excess acid production in the stomach and can eventually land up in complications. Okay, and also decrease fatty food intake. Fatty food intake like cheesy food, processed food, canned foods. All these things can only aggravate the acidic contents in the stomach and can cause more irritation. Okay, then avoid lying down within 1 to 2 hours of eating food. Why you should do this? Because when you lie down immediately, if your sphincter is probably loose, the stomach content, whatever it is, slowly ascend upwards into the esophagus and cause more irritation. So it is minimally advised that 1 or 2 hours, minimum of 1 hour, you're not supposed to lie down. You're supposed to have a quick walk, quick, at least you should, the least you could do is sit down and not sleep down. Sleep immediately after having food. So next, coming to elevate 4 to 8 inches on bed, that is, you have to elevate the head. Usually people, when we tell them to elevate, they usually put 2 or 3 pillows below their neck and sleep. That is the wrong method to do it. You have to elevate the entire bed. That is, you have to keep about small, that is, a brick or anything like that below the legs of the bed. That is, so that the entire bed is elevated and not only your neck at the pillow level. So that will eventually help in lowering the symptoms, that is lowering the passage of food from the stomach into the duodenum downwards, and prevent it from going reverse into the esophagus. And then you can avoid unnecessary intake of NSAIDs. So you're not supposed to take NSAIDs unnecessary. What are NSAIDs? NSAIDs are over-the-counter available painkillers, that is diclofenac, and all unnecessary medications that are available in the counter, which a medical store person will not know when to give it to whom. So fever patients also take NSAIDs. So you're not supposed to take NSAIDs without a doctor prescription. So it might have immediate relief on your fever or body pain symptoms, but eventually you are going to land up with gastritis. That is also one thing that you need to keep in mind to unnecessarily avoid. So it is better to take a paracetamol than any painkillers if you are not very sure. So last, you can avoid tight clothing. Okay, tight clothing can also cause sphincter, that is mistaken the sphincter for some pressure from outwards, causing on the sphincter and can cause a disruption in the functioning of the sphincters. So definitely people who are obese will also have such dyspeptic symptoms. Okay, so that will also, we'll have to keep in mind that having low weight is also one important thing. Last but not the least, smoking is very important. Not, you have to quit smoking. This is the most important part, where smoking only aggravates the acidic contents in the stomach. Apart from GRD symptoms, a patient might also need to undergo corrective surgeries, that is anti-reflux surgeries, correction of hiatus hernia and fundoplication. So correction of hiatus hernia, fundoplication can be done for severe GRD symptoms like I told you, that is for hiatus hernia